Menopause marks a significant milestone in a woman's life. It's a time when periods stop and women are no longer able to bear children. Now, the average age of menopause is 51 years old, but could occur as early as 30s and as late as 60s. Joining us right now to talk a little bit more about the truth of menopause is Dr. Kenneth Finkelstein. Thank you so much for joining us. We appreciate it.
Darling, thanks so much for having me back.
So let's talk about this. What does it mean to be in menopause?
So menopause by definition means that you've actually run out of eggs. So each woman is born with a very large amount of eggs, but a finite amount, right? That's every month you ovulate, keep the human species alive, have children. That's how that works. When you run out of eggs, your body realizes it. That actually is menopause. So the body's reaction to running out of eggs is it shuts off your hormones. So your ovaries produce estrogen, progesterone, testosterone. When you run out of those hormones, that actually puts you into menopause.
Is that when the hot flashes kick in?
Oh, yeah.
Irregular periods. Talk about the symptoms of menopause.
So,
how do you know?
So symptoms of menopause are this. So you stop having your periods. Having no periods for a year is menopause. Hot flashes, night sweats, mood swings, vaginal dryness, insomnia. These are all a lot of the symptoms that come from that stopping of the hormonal levels in your body.
Okay, now how do you deal with what's going on with your body? I have some friends that have taken some steroids. I have some friends that have tried some herbal teas or some herbal remedies. I've even got some friends wearing those necklaces to try to cool you down. They may work for a few minutes, but not so.
Yeah, so I think that there's a couple of ways to look at treatment. So over-the-counter treatments are usually things like black cohosh. They can help a bit with hot flashes. People talk about soy, which honestly in all medical studies have not shown to work. There are women who use SSRIs, which is a type of antidepressant, especially breast cancer survivors who can't take estrogen. You can use that for mood disorders and a little bit for hot flashes. Things like the vaginal dryness and the painful intercourse we've talked about earlier with the vaginal restoration laser, which has no chemicals or hormones, and that's very safe, and that works amazingly well.
With instant results that you talked about as well.
With instant results. It's pretty amazing. but what I think the mainstay of therapy is actually hormones. Replacing what your body's missing is really what fixes the symptoms.
Okay, but do they have an increased risk for breast cancer, though? Is that the debate out there?
Yeah, I don't think it's much of a debate as much as maybe there's misinformation given to the public when this all came out. So the WHI study that was published about 10 years ago, 13 years ago actually, this is what it showed. In women who took combination hormones, estrogen, progesterone together, there was an increased risk of about 28% for breast cancer compared to two groups of people, those that took no hormones at all and those who have had hysterectomies and took estrogen only. So the reality is it's not estrogen that causes breast cancer in postmenopausal women, it's actually progesterone. And then the follow-up 10 years later, it showed the same result. So I think there's, unfortunately, like anything else, misinformation. And this study also was done in a group where the average age of the woman was 65. So for early menopausal women who still have a uterus, every major medical association says it is safe to take combination hormonal pills until you don't need them. What we don't want people doing is staying on hormones past the time they need them. But if you've had a hysterectomy and you're taking estrogen only, it does not increase the risk of breast cancer.
So this study, the WHI study that you just talked about, dealt with women average age 65, but isn't the average age of menopause 51? But then we just said you could get hit in your mid-30s. I know some people who said they started the hot flashes then.
Well, so perimenopausal symptoms, right? You can actually have symptoms of menopause 5 to 7 years before going through it. Those patients actually respond extremely well to low-dose birth control pills. If you're not in menopause yet, trying to use postmenopausal therapy doesn't tend to work, has a lot of side effects. So for women who are earlier, right, 5 to 7 years prior to menopause, have the symptoms but are not in menopause yet, they respond really, really well to a low-dose birth control pill.
Okay, and I got to ask you quickly before we let you go. I've heard some women talk about how they don't have or don't deal with as many symptoms after having a hysterectomy. Is that true?
Well, I mean,
so many of the menopausal symptoms.
So here's what I would say, and this is what I would differentiate. If I do a hysterectomy and I remove your uterus but do not remove your ovaries, you're not in menopause. Those patients who go into natural menopause tend to do better than women who had their ovaries removed during their hysterectomy and they're put immediately into surgical menopause. And while they're both menopause, sometimes that sudden movement where your hormones literally disappear the next morning gives you a lot more symptoms. But you're still treatable, though.
Okay, I don't know why all of a sudden I'm having a flash. Dr. Finkelstein, thank you so much for joining us. If people want more information about what you just talked about, where can they go? Because you're out at Christ Hospital, but what's your website?
Yeah, so our website is whcillinois.com. Feel free to give us a call. We would love to help people, and that's what we do every day.
All right, good deal. Good to see you.
So
Thank you so much.
Good to see you again.
Good to see you. Thank you.